what Senator Cassidy said is our goal is to make sure that no matter what state you live, that you're going to get X amount of dollars, and it's going to be fairly equal no matter where you live. So what we're doing is we're leaving the taxes on the wealthy in place. To my conservative friends, I'm sorry, but that's what we're going to have to do to make this work. We'll eliminate the medical device tax because that hurts innovation. We'll eliminate the individual employer mandate because that stifles the whole idea of having creativity at the state level. And we leave the taxes on the wealthier Americans in place, and we're able to take that money, plus money we would give to insurance companies to stabilize a national market, and block grant it back to the states with a formula that's fairer.
Now, am I right today to talk about my amendment, Heller Amendment number 288? My amendment reinforces the important role Medicaid has played in my home state and the state of many others of my colleagues that are here today. I've said since the beginning of the healthcare debate that I will only support a solution that protects Nevada's most vulnerable. The House bill didn't go far enough to do that, and neither did the Senate's bill. And that's why I voted against it last night.
According to the National Institute of Health, NIH, a health desert is a place where people have very limited or no access at all to basic health care. Causes of health deserts can include geography, economic conditions, provider shortages, and a lack of infrastructure. Especially for rural residents, the distance to health facilities can be a challenge, especially for residents who do not have reliable transportation. Then, the high cost of the healthcare industry itself can be too great for some lower-income areas, resulting in residents not seeking proper treatment at all. If that was not enough, there may be shortages of proper medical staff at rural facilities, and sometimes those health infrastructure facilities are not enough or are not designed to handle some of the more severe medical cases. While medical facility access is a problem, even access to pharmacies may be a challenge for rural residents, with states like South Dakota, Montana, Kansas, and Nebraska having many counties facing limited access to pharmacies. In New Mexico, some of the Navajo Nation lack access to running water, let alone medical treatment centers. Lastly, please note that health deserts are not only a rural issue, but it is a large issue in urban areas as well, with African Americans in larger cities being more likely to reside in a trauma care desert. In order to tackle these health deserts, the United States government needs to increase funding for healthcare facilities in rural areas by providing grants to build healthcare facilities, fund mobile clinics to bring care directly to overlooked areas, both in urban and rural areas, and improve telehealth access by increasing network capabilities in rural areas. They can partner with companies like AT&T to increase fiber optic infrastructure in rural areas. The government can do this through programs partnering with states, counties, local towns, local nonprofits, and corporations. Lastly, the government can work with insurance companies to expand transportation benefits in their insurance programs. According to the University of South Carolina, cancer patients in rural areas had to travel around 40.8 miles to the next radiation treatment, bearing the brunt of that cost. Expanding teleservices by expanding rural network infrastructures and expanding transportation benefits would go a long way in tackling the presence of rural health deserts in the United States.